Assalamualaikum and good morning to our lecturer Dr. Muhammad Saipul bin Muhammad Sukur and to my fellow friends. Today our group will present about psychological disorder and we choose bipolar disorder as our topic today. First, let me introduce myself. My name is Nur Ifarashka binti Amran and now I will explain to you about bipolar disorder in general. Bipolar disorder, also known as manic depressive illness, is a brain disorder that causes unusual shift in mood, energy, activity level, and ability to carry out day-to-day tasks. Bipolar disorder usually starts in adulthood or early adulthood, also can occur occasionally in children. This disorder also can happen to first during pregnancy and after childbirth. Bipolar disorder symptoms are severe and it's not easy to get detected when it starts. The symptoms seem like separate problems but not recognized as a part of bigger problems, so that many people suffer for years before getting a proper diagnosis and treatment. Just like diabetes and heart disease, bipolar disorder also a long-term illness that need to be handled carefully during personal life. There are two different forms of episode in bipolar disorder, manic and hypomanic. Manic usually occurs for at least 2 weeks and manic is more serious than hypomanic. Some people who having this disorder will experience some emotional symptoms and maybe some not experience any. Though bipolar disorder is a long-term illness, by following the treatment plan, it can help us to control our mood swings and other symptoms. In most cases, bipolar disorder is treated with a medication and psychological counseling or psychotherapy. There are no diagnostic tests are available to determine this disorder, so mental health professionals will diagnose this disorder based on history and symptoms of the individual. There is no sure way to avoiding this bipolar disorder. However, seeking medication at early sign of mental health disorder will help us to avoid further deterioration of bipolar disorder and other mental health disorder. So next, I will pass to the next presenter.
Now, I will talk about mania. Mania is a condition where a person feels excessive excitement or altruism craze. The person will show physical hyperactivity and cannot organize their behavior well. It is a long-lasting period and it brings out a negative impact to their daily routine. First point is speech disruption. Speech disruption is a symptom of bipolar disorder when they are in mania state. Speech disruption can be described as a person that has motor mouth, and it is difficult for other people to interrupt the conversation when the person is talking. For instance, they will speak in a rapid moment and make it hard for other people to understand what they are talking about. Besides, their content of conversation will become incoherent and rambling. Patients of bipolar disorder that is in manic state score high in the amount of talking. The next symptom of bipolar disorder is mood changes. For instance, the patient that suffers from bipolar disorder will suddenly change their mood without any significant reason. It is a long-lasting period and it is difficult to let the patient go back to the normal mood state. The other symptom is change in thought pattern. Their idea and way of thinking can be shift and change quickly. They may have racing thought, which is a rapid stream of thought, but the thought is often repetitive. Besides, the creativity and innovation will suddenly go up quickly. Sometimes, they will also lose direction in their thinking such as in disorientation or disjointed thinking state. Next, I am going to let Pang explain.
Sleep change. The sleep quality will decrease, such as they will in insomnia, often wake up in the midnight, oversleep, or wake up early in the morning. Due to the sleep quality decrease, the REM sleep also be affected. As we know, REM sleep is very important because we will produce dream in the time and process our emotional and experience. If the REM sleep not occur, it will affect our emotional and mental health. So the bipolar disorder patient in depressed mood will happen sleep change. Then they will feel hopeless and helpless to this world. It is because the self-esteem and self-confidence will decrease. In a time they are hard to receive help from others and lost expectation to this world. So the hopeless and helpless feeling will occur when the bipolar disorder patient is in a depressed mood. Next is concentration problem. The patient of bipolar disorder have the brain damage. For example, hippocampus. The volume of hippocampus will decrease and it will affect our attention or concentration of some things. And the last is negative self-concept. They will feel like they are useless to this world and they are no more enjoy their lifetime. The negative self-concept will lead to negative talk and affect their thinking ways and action. In the worst situation, they will have the self-harming. So this is the symptom of bipolar disorder patient who is suffer in depression. Now I will pass to Aisha to explain the causes.
Thank you, Pang. My name is Sita Aisha binti Zakaria. I will present about cause of bipolar disorder. There are three causes of bipolar disorder. The first one because of genetic. The second one because of imbalance between cholinergic and catecholaminergic neural activity. The third one because of childhood trauma. We go to the first one because of genetic. So, scientists have found that human traits by genetics can be inherited by the next generation, like intelligence and disorder. Transported genes might be relevant to the tendency of developing bipolar disorder, but probably have a small effect on the development of this disorder. So we go to the next cause of bipolar. So imbalance between cholinergic and catecholaminergic neural activities. So as we can see that neurons are certain to contain either the neuron transmitter dopamine. So it also known as one of the cell in the brainstem project axons and play an important role in neurosensory cells during stress. It was also important for motor, affective and behavior and also cognitive. So patients with bipolar disorder have a red blood problem and have a history of predominantly manic episode. So based off the review highlights the importance of cholinergic and catecholaminergic important in depression and have a potential to get a bipolar disorder. So we go to the next one is a childhood trauma. So almost 50% of patients with bipolar disorder frequently have a post-traumatic stress disorder. So this trauma give an effect to influence the clinical cause and indirectly childhood trauma can increase rapid cycling, mood episodes, maybe they have a risk of suicide attempt and also drug abuse. So disorders are more exposed to negative life events than the positive life event. So we believe this and all of what they face in this disorder also come from of their experience, effect of trauma a part of bipolar disorder. It also will cause more problem arise like feel scared, angry and cannot sleep. So there are three causes of bipolar disorder that I have explained to you and we go to the next presenter.
Thank you, Aisha. My name is Najwa and now I'm going to explain about the impact of the bipolar disorder on the patient. Obviously, there are a lot of difficulty and struggle that are faced by the patient, but I'm going to focus on the three main impacts that usually happen, which is strained marital family relationship, unemployed and decreased productivity and financial stresses. So the first impact is strained marital and family relationship. As we know, people who are diagnosed with this disorder needs an intensive care by the family. At some point, the family will perceive this patient as a burden. By saying a burden, there is actually two kinds of burden, which is objective burden and subjective burden. Objective burden is when there is a disruption to the family or household life, which we can see, while Subjective burden involve personal feelings such as distress. If the family see the patient as a burden, it will affect their marital or family relationship, and the patient will become more independent. Thus, it will lead to many family problems such as divorce. Moving on to the second impact, which is unemployed and decreased productivity. As we know, it is hard for the patient to stay focused in their job because of the symptoms. Sometimes it is hard for them to interact with other co-workers, and it will lead to decreased productivity. Sometimes the patient have to miss their work because of the symptoms, and as we know, absenteeism and low productivity will end up making the patient lose his job. The third impact is financial stresses. The patient may have the reduced abilities in managing their finance compared to the healthy person. As stated earlier from the previous presenter, the patient is not in their right mind when the episode occurs. They tend to overspend their money, which will lead to financial stresses. In addition, the cost of the medicine and the treatment are expensive, and most of the insurance company does not cover for any psychological disorder treatment. So it can become a huge burden for the patients, and it will increase the financial stresses. So that's all for me, the impact of the bipolar disorder on the patient. Now I'm going to let the next presenter to present about the treatment of the bipolar disorder.
Okay, now I will explain about the treatment of bipolar disorder. There are two types of treatment for bipolar disorder. The first one is pharmacotherapy and the second one is psychotherapy. I will explain about the pharmacotherapy first. Pharmacotherapy is a general term of using medication to treat any disease. The most commonly used medication is lithium. For your information, lithium is one of the successful treatment for bipolar disorder. However, patient must follow the doctor instruction to make sure the medication will work effectively. Other than that, there are other medications that can be used, which is anticonvulsant and carbamazepine. If these two drugs is not fully work, sometimes antipsychotic and also antidepressant drug will be supplement them. To the psychotherapy. Psychotherapy is a range of treatment that function to help with mental health problem, emotional challenges, and some psychiatric disorder. The first one is cognitive behavioral therapy. This therapy is about self-monitoring, problem-solving, motivation to take a reliable medicine, and preparation for active relapse. This therapy is recommended for supplementary treatment for patients with a less severe form of bipolar disorder. This therapy also can help patients to change their mind and respond from negative to positive. The second one is family-focused therapy. This therapy only involves the patient and the caregiver. This therapy will focus on communication style between the patient and the family members. It is because communication and support from family members can help patient to follow all the treatment plan, and also can help the patient and their family members to recognize and manage warning sign of mood swing. The third one is interpersonal and social rhythm therapy. This is one of the therapy that use a problem-solving approach to interpersonal problem by encouraging patients to maintain and regulate their daily routine, wake and sleep rhythm. It is because consistent routine allow a better mood management. The last one is group psychoeducation. Psychoeducation usually will involve some group that highly structured and follow to the educational and skill training agenda, but they are also oriented toward telling the story, getting support, and also suggestion from the people who have gone through a similar situation. Psychoeducation also can help people around the patient with bipolar disorder to understand their condition.
And psychological disorder is a real illness just like an other medical illness such as heart disease or diabetes. We should not perceive it as a small matter or set aside this problem. We should start to be more aware of this disease and be supportive to those who are being diagnosed with it. World is a better place when there are people that care of each other. Thank you from us. Stay safe, stay home.